Healthcare costs are on the rise, and Medicare Part B costs are no exception. 6 on Your Side reporter Jack Ziskin is in the studio with more. Jack.
Thanks, Elena. Medicare Part B premiums are projected to rise about $18 per month from $185 to $202 on average. Medicare Part B costs are rising, and even insurance agents will feel the effects.
I turned 65 in January, so we've been talking about the process and getting all the paperwork filled out.
Eve Minette recently completed her paperwork to get Medicare. It took longer for her than you might expect.
It took me about an hour to online.
Minette was able to do it online without having to pass a physical or prove who she is. Minette is lucky. Not everyone is, especially those who need it most.
That's the sad part about it. A lot of folks, they'll give up on trying because a lot of times they'll be turned down for whatever the reason. They may have filled the application out wrong.
Insurance agent Sammy Sawyer works with Minette. He says many people struggle to secure the assistance they need to save on their premium.
We have a lot of folks they qualify for LIS and assistance where their income is lower, and so they don't have to pay just a portion or zero.
Advocates say that the new rules and regulations in President Trump's signature One Big Beautiful Bill will only make the problem worse.
There was a rule that was aimed at trying to streamline enrollment and eligibility. That rule has been suspended for 9 years under that bill, which means that more people will go without such assistance than previously was the case.
David Lipshut says cuts to Medicare, TennCare, and other programs will make it even harder for people to get health care.
I've got several examples of that, of where folks have just, they continue to go back and say, hey, I'm going to reapply, and they get the extra help.
Sawyer says people shouldn't give up if they are rejected. Minette wasn't, and she says Medicare has helped her family and the people in her life.
My ex-husband fell and broke his hip, and there was a lot of costs involved with that, and his end billing was around $200. So, yes, it sounds like that's the way I'll be leaning.
The Center for Medicare Advocacy says rising Part B costs, coupled with nearly $1 trillion cut to Medicaid, will hurt providers and patients.